Hi, I'm Dr. Christopher Mote of Cornerstone Health Community, and today I want to talk to you about cognitive decline and dementia. 5 million people in the United States suffered from this just a couple of years ago, and we're pretty sure that within the next 40 years, that number will triple to almost 15 million people who have this. And most of us either do expect that we could have somebody caring for us as opposed to us caring for ourselves, or we know somebody that we will be caring for. So this affects us all. It's the only one of the 10 most common chronic diseases in our United States that has no pharmacologic cure. And drug companies have been trying for 25 years, and it's likely because there's more than one cause. Symptoms like this, short-term memory loss, poor concentration, confusion, anxiety, those are the symptoms we all see. And just to kind of delineate for you, if you walk out of a grocery store and you can't remember where you parked your car, even for several seconds, that's not the beginning of dementia. But if you drive your car home into your subdivision and cannot remember which house is yours, and you start driving the neighborhood, hitting the garage door opener, hoping your door will open, that's concerning. So when we have symptoms like this, rather than depend on pharmacologic approaches, we start looking at the underlying factors, and these are the underlying factors. We see nutritional deficits when we run blood and urine testing, and those nutritional deficits do not allow the neurons in the brain to function properly. We will see a lack of quality sleep, including sleep apnea that went undiagnosed and untreated, and a simple sleep study at home can determine that. And then we see chronic inflammation in the form of foods, alcohol, gluten, and even glyphosate, that active ingredient in Roundup. You can learn more about these if you look at some of our other videos, because we spend a lot of time on this section. And then there's biotoxins. This is perhaps the most detrimental chemical toxicity to our brains, and it has several possible sources. There isn't just one, and this is why I think it's so hard. When we treat dementia and cognitive decline in our practice, we look carefully at people who have been exposed to water damage. And in that water damaged building, they could have picked up mold or marcons, which is a bacterial overgrowth in the nasal passages, both of which just hammer the brain with inflammatory toxins. And then from the gut, you have H. pylori, which makes toxins, Clostridium difficile, bacterial overgrowth called SIBO, parasitic infections. In the mouth, you can have root canals that have become infected and inflamed. So there's any number of sources for these biotoxins, and we play the medical detective to look for and eliminate these sources of biotoxins. We put the other resources we have here at Cornerstone Health Community around you, and we hope to help you to keep your mental faculties and your ability to care for yourself long into old age.